If you are treating a skin eruption as just a skin problem, you are missing 90% of the case. In fact, that topical steroid cream might be the worst thing you can give your patient. In classical homeopathy, the skin is the mirror of the soul. That eczema, that psoriasis, that acne isn't an isolated event. It's the final outward expression of deep internal emotional disturbance. It's the skin mind connection. Today, we are going to stop suppressing symptoms and start understanding why the body chooses the skin to express grief, anger, or despair. Stick around to learn how to identify the three most common skin mind profiles in your clinic and how to prescribe the true similimum that heals from the inside out. Hahnemann taught us that the vital force always attempts to move disease from the center, our vital organs and mind, to the periphery, the skin and mucous membranes. This is a survival mechanism. The itch is a sign that the system is trying to relieve internal tension. What happens when we apply a suppression, like a strong topical ointment? We push that disease back inside. This is why we so often see asthma develop after eczema clears up. The skin may look better, but the patient is actually sicker. We heal from within outward.
Today, we're putting on our detective hats. We've got a really fascinating mystery to solve, and it's all about chronic skin conditions. But here's the twist. Our investigation isn't just going to be skin deep. Oh no, we're going way deeper, into the mind, to crack this case from the inside out. So, let's get started.
Okay, here's our game plan. First up, we're going to decode the skin's secret language. Then, we'll dive into 3 key case files: the griever, the stagnator, and the outcast. After that, we'll hit the final diagnosis and wrap it all up with what this means for your body's own story.
So, first things first, we've got to establish our primary lead. And the fundamental idea here, the one that our whole investigation hinges on, is this: your skin never, ever acts alone. It's really just an outer reflection of a much deeper, more complex story happening on the inside.
So let's just ask the big question right out of the gate, shall we? I mean, what if that rash you have, or that persistent itch, or that super dry skin, what if it isn't just some surface-level annoyance? What if it's actually a message, a clue being sent directly from your body's internal command center?
And look, this connection, it's not just some nice philosophical idea. It is literally baked into our biology. Think about it. When we're just tiny embryos, the layer of cells that develops into our brain and nervous system is the exact same layer that becomes our skin. They're basically born from the same stuff. So they're intertwined for life, always talking to each other through this shared language of hormones and neurotransmitters. Okay, so here's the really crucial point. If you think of the skin as a kind of exhaust valve for all that internal stress, well, what do you think happens when we just block it up? This is a huge concept in homeopathy called suppression. See, when you use those strong creams to just make a rash vanish without fixing the root cause, it's like plugging a volcano. The pressure doesn't just disappear. No way. It gets forced deeper inside, where it can mess with more vital things like your lungs or even your mental state. And that right there is why this detective work is so incredibly important. All right, time to open our first case file. Our primary person of interest here is a very specific emotional state: deep, unexpressed grief. And the remedy profile we're putting under the microscope is natrum muriaticum.
Now, the core emotional state we're talking about here, it's not just regular sadness. We're talking about grief that has been consciously, actively walled up and locked away. This person has built a fortress around their heart. They might replay a past hurt over and over in their mind for years, but the second you try to offer some comfort, they push you away. It's this profound paradox. They prefer to suffer completely alone. And this is where we see that mind-skin mirror just perfectly. All that emotional dryness, that hardness, it shows up physically. You'll see things like super dry, cracked skin, chapped lips. The eczema tends to show up in the creases, the bends of the elbows and knees, or right along the hairline. It's like the grief is settling at the very edges of the body. And get this, a fresh emotional shock, or even just dwelling on that old pain, can trigger a flare-up almost instantly.
Okay, and here it is, the clinical pearl, the key piece of evidence that cracks the case wide open. If you've got someone with that dry, grief-driven skin who also has an intense craving for salt, and I mean an intense craving, like they might eat it right out of the shaker, and on top of that, they get annoyed when you try to console them, boom, the case for Natrum muriaticum becomes almost undeniable. It's the classic combo that points right to our suspect. Okay, let's move on to our second case file. This one is totally different. Our suspect here is defined by one word: stagnation. We're talking about a feeling of being completely stuck, both mentally and physically, and the remedy we're investigating is graphites. So, the core mental state for this one is this feeling of, well, sluggishness. Think of a mind that's just slow and heavy. These folks are often timid, they can't make a decision to save their life, and they're really lacking in confidence. They get completely bogged down by tiny little things and might even burst into tears over something that most people would just shrug off. It's like their whole psychological state has become thick and slow-moving.
Now let's look at the mirror on the skin, because it is uncanny. That mental stagnation shows up physically. The skin gets thick, hard, and it cracks. But here's the unforgettable part: the discharge. It oozes the sticky, thick, yellowish gunk that looks for all the world like honey. You see it a lot behind the ears, on the eyelids, or deep in the folds of the skin. It's a perfect physical picture of being stuck.
So for us detectives, here's the giveaway. Remember Nature Myrrh? That was all about being dry and cracked. But graphites is thick, cracked, and it has that signature honey-like ooze. When you see that very specific skin symptom and it's happening in a person with that sluggish, timid, indecisive mindset, well, graphites goes right to the top of your suspect list. And now it's time for our final case file. And I have to tell you, this state is often the most intense of all. It's one that is just defined by a profound sense of despair and absolute hopelessness. Our last suspect is Suriname. The core mental picture for Suriname is just utter hopelessness. This isn't just feeling down. This is a person who is deeply convinced that they will never get well. It's a bone-deep certainty that they're incurable. They feel completely insecure, desperate, and just like an outcast from the rest of the world. And of course, this profound inner despair gets projected right onto the skin. The skin itself just looks unhealthy. It can look dirty and lifeless, even if the person washes constantly. The rashes are incredibly itchy, usually dry and scaly, and sometimes there's even an offensive odor. It's as if that internal feeling of hopelessness is physically manifesting as decay on the outside. But here's the clue that just nails it every time, the undeniable clinical pearl. People who need Suriname are incredibly chilly. We're talking wearing a winter coat in the middle of summer kind of chilly. So when you see that profound chilliness combined with that dirty-looking skin and that mental state of absolute despair, you've got the classic Suriname trio. Case closed. Okay, our investigation is officially complete. We've gathered the evidence and interviewed our 3 main suspects. Now, it's time to bring them all into the interrogation room for a final lineup, so we can compare their stories side by side. So let's just lay it all out. First, you've got Nature Myrrh, the griever. The keynotes: walled-up grief, dry and cracked skin, and that dead giveaway combo of craving salt but hating sympathy. Then graphites, the stagnator. Think mental sluggishness, thick skin, and that unforgettable honey-like ooze. And finally, Suriname, the outcast. This is all about hopeless despair, dirty-looking skin, and an extreme, unshakable chilliness. You see, each internal story leaves a completely unique fingerprint on the body. So, we've cracked the case. We've figured out our suspects. But really, the most important question is, what does all this detective work actually mean for you and your own health journey? Let's boil it all down to the key takeaways from our investigation. Number 1, your skin isn't just a covering, it's a roadmap to your internal world. Number 2, our deepest emotions have their own unique physical signatures. And that means, and this is so important, that real lasting healing has to come from the inside out. And finally, remember this: the goal is never, ever just about getting rid of a rash. It's about understanding and healing the entire story of the person. So, as we close this case file, I want to leave you with one final thought. If your body is constantly sending you messages through its symptoms, what story is it trying to tell you? You know, the clues are all there. The real work is just learning how to listen.